I'm Mark Barry. I'm a pediatric orthopedic and spine surgeon, and I'm here to show a low-tech technique of putting in pedicle screws as accurately as possible, for example, in the thoracic spine. Here we are with a spine model, significant scoliotic curve with significant rotation. We're going to instrument T9 on the convex side. I want to show you, this is the device that's going to make this easy. Basically, it's a K-wire about 9 inches long with an olive placed at the strategic level, and then a handle and a kind of like a drill guide with this barrel here, where if we place the K-wire in this barrel, you can see that the olive stops penetration at 2 centimeters. And that's important. You don't want to go past about 2 centimeters on your initial penetration, because you're getting into the pedicle from the dorsal surface, through the pedicle, past the neural canal, and into the back of the vertebral body, and that's all you need to start. So what we do is orient the C-arm down the longitudinal axis of the pedicle. And you can see we've already done that ahead of time, all right? Basically, we get an assessment, based on anatomical studies of, where the canal should be relative to, what level we're at, the degree of rotation, estimated degree of rotation, etc. And here we are set up such that you can see on this image that this is where we're going, this pedicle here, and you can see that the oval en face image of this pedicle, the cortical outline of this pedicle, is sitting in the upper outer aspect of the underlying vertebral body. And that basically is an indicator that we are collinear with the C-arm and the longitudinal axis of the pedicle. So we're ready to go. So we take a K-wire driver and our guide, and we come to the site that we want to instrument. And based on topography, we say, all right, it should be more or less in this region. And you can see, here we are, pretty much in the center of where we want to be, in the center of the underlying pedicle, okay? With this, we can tilt the device up so that it becomes collinear with the longitudinal axis of the C-arm and obviously the pedicle underneath, all right? So we'll take another shot, and we can see that we are almost collinear, and we just adjust it slightly so that we can get the desired direction. And then we start drilling. So we drill in 2 centimeters, the olive stops us. We come out and we probe. And we're looking for the lateral wall, the medial wall, the cephalad wall, and the caudad wall. The floor obviously is only 2 centimeters, so we're good there. And then we can go ahead and use a gear shift to get our desired depth and also to enlarge the hole. So once we get this gear shift down, I'm not going to go all the way down, but basically this is the idea. Very simple, standard technique. About 4 centimeters down at this level, 3.5, 4 centimeters. And then we send the probe down again after the gear shift has done its work. Lateral wall, medial wall, caudad and cephalad, and the floor at 4 centimeters. And then we're ready to place our screw. Either tap, I use an undersized tap, or just go ahead with the proper sized fixed head pedicle screw in this situation. Besides efficiency and minimal radiation exposure of this technique, another advantage is with this guide, we can keep our hands out of the C-arm beam as we're doing our work. So this is about 9 inches long. And here we are about 10 inches away with our drill, and you can very, very simply drill down with this 1.6 K wire bent like this. And that is a very simple technique. The advantages of this technique is that it's very low tech. It's just a fluoro, which we use either 4 or 8 pulses per second, and that dramatically decreases the radiation exposure. I've shown over hundreds of cases that I can basically place a pedicle screw with 1 second of radiation by using reduced fluoro, using pulsed fluoro.